Welcome to the Goddesses of Social Work podcast, hosted by Renita Ray Davis, licensed clinical social worker, board-approved social work clinical supervisor, and facilitator of the Goddesses of Social Work supervision community. Join us as we travel through the social work journeys told by the Goddesses of Social Work community members, past and present, as they make their way toward clinical licensure.
Welcome to the Goddesses of Social Work podcast. I'm here today with Dr. Ashley M. Toland, LCSW. Dr. Ashley M. Toland, an assistant professor in the Department of Social Work, is a licensed clinical social worker with over 15 years of experience in the field. Her practice experience includes administrative social work, nonprofit management, grant writing, school-based social work, community mental health, work within the court system, substance use intervention, inpatient treatment with adults, and outpatient counseling with adolescents, adult, and aging adults. Dr. Toland received her DSW from Tulane University in 2022. There, she completed 2 advanced practice projects titled The Mental Health Implications of Adoption Trauma on People Adopted at Birth and From Denial to Disproportionality, History of White Supremacy, Structural Racism, and the Child Welfare System. Her research interests include adoption trauma and the adoption triad, child welfare, family policing reform, and resilience-informed mental health care. Welcome to the show, Ashley.
Thank you, Renita. I'm glad to be here.
Wow, what an amazing bio. And what diversity and topics of interest within the profession, from adoption to white supremacy. But I think without going into your social work journey, I am wondering if you could speak more about resilience-informed mental health care. Most folks talk about trauma-informed mental health care, but resilience-informed seems more strength-based.
It is, and that's really why that became an area of interest for me. I was fortunate during my time at Tulane to earn a fellowship with a mentor from the International Institute of Restorative Practices. You can find information at iirp.org. And everything at the IIRP is focused on resilience, restorative practices, restorative justice. And so in my work with my mentors at the IIRP, we started talking about how everything is trauma focused. Everything is trauma focused, and anything can be traumatic. You know, trauma can be real or perceived. And we started talking about the differences in how siblings respond to trauma. People reared in the same home can have identical experiences and completely different outcomes. And we started talking about the fact that that must have something to do with resilience and the way people cope, the way people internalize trauma, and the stories we tell ourselves. And of course, some of that may be linked to personality, but coming from the social work perspective, the strengths and empowerment perspective, I really prefer looking at things through the resilience lens. And so I'm actually working with my mentor from the IIRP on research right now about what makes resilience, what is resilience, and how can we harness that to minimize the impact of trauma and to heal people more efficiently that are really still struggling with trauma, with PTSD.
And so, Ashley, what is resilience? Resilience is one of my favorite words, and I talk about it a lot with my clients. And so I know there's a lot of research, but do you mind defining what is resilience?
In my mind, resilience is how people are able to reframe a negative or traumatic situation so that it does not traumatize them forever. Okay, so we may go through a traumatic experience, right? The way a person tells themselves, okay, this is the narrative of what happened, they may continue to be traumatized by an event forever. A person with high levels or strong resilience, they're going to be able to flip that narrative, even though what happened was still traumatizing. They may still have certain symptoms of PTSD, for example. They're not going to forget what happened, so to speak. But they may also be able to move forward in a way where they're not feeling traumatized by that event every day. And a person who can do that organically, that's resilience. Flipping the narrative, organically using those kinds of coping skills that are healthy and implementing that behavior and that script flipping, I guess, so to speak, in an organic way that is just natural to that person. That is resilience. And I do think that part of it is just in us. Some people are more resilient than others, but I also believe it's a skill that we can teach. And we should be teaching that. We should be teaching people, look, this is how you can bounce back. It may not be overnight, and it may take some work. It may feel very uncomfortable at first to practice resilience, but let's try it.
I love that. It feels like it's more in line with the values of social work, actually.
Yeah, I feel like it is much more aligned with the strengths perspective than rooting everything in trauma. We know trauma exists. That's not new. I think that focusing on strengths perspective based ways to address trauma and really help people heal is the key.
It does feel like that is the key. Yeah. Thank you for doing that work. I'm so curious now. Are you getting any, because trauma informed has like been the buzzword for a few years now, right? And so this was one of the first time I've heard of resilience informed. In the work that you're doing with the organization, and personally, are you getting any pushback from those folks who are so rooted in the trauma informed practice?
Not yet. Again, this is new research that we're doing, and it's really something that we stumbled on together in my time under the fellowship at Tulane. And so it's not something that we have published yet. We're still gathering data and information, kind of creating that literature review. But I don't know if I should expect pushback. I'm sure that there will be some people who feel that it's a Pollyanna kind of way of looking at the world. You know, oh, look, we're going to all be resilient and everything's going to be fine. But I think if we're able to carefully, strategically, and in a meaningful way define resilience and find a way to measure it and identify what is the source of resilience, what makes one person more resilient than another, and how do we grow that in people, then I think there's legitimacy there, and I believe we can.
I absolutely believe we can. I think social work is the perfect place to start that.
Me too.
I absolutely believe that we can. That's so good. Thank you again for doing that work. And I'm excited to read more about resilience informed mental health care. Yeah. Actually, I cannot wait to hear about your social work journey. You can start wherever you like, but you have such diverse topics of interest. I'm just wondering, like, one, how did you learn about social work and how did you get into so many areas of social work?
Right. Well, I mean, I would say my very beginning introduction to social work was when I was a tiny child. I was adopted at birth and very sick, just chronically ill. 1975, no medical information about birth mom. And my parents, we had to spend a lot of time in hospitals. And I came into contact with social workers there. And they were my favorite people in the hospitals because they usually had the book cart or the toy cart. These are children's hospitals, Arkansas Children's, Oklahoma City Children's. And I just knew that they were nice and they made my day brighter and I liked them. And also during this time, when you're in a children's hospital for long periods of time, you see very sick children and sick children who don't have as much as you or who have parents who aren't able to stay with them all the time. And I think that just kind of supercharged my empathy for people. And so growing from that, I ended up going to school in my bachelor's program on scholarship for musical theater. I did not start out in social work. I was going to go to Broadway, okay? And I love musical theater. But when my friends started moving to New York, I thought, oh, I don't think I have the grit for this. I like health insurance and I like having my own bed and knowing where I'm going to be at night and having a 9 to 5 kind of thing. So I switched to sociology. There was not a social work program at my undergraduate university. Luckily, my first job upon graduation was for a home health and hospice organization where I worked under an MSW. Her name is Ruth. And Ruth opened my eyes to everything social work can be. She said, why don't you have a degree in social work? You have to go get your MSW. And she showed me how broad the profession is. She shared with me the values and ethics, which completely aligned with who I am as a person. I had no idea this profession even existed in that way. And so I feel like I owe Ruth everything in terms of introducing me to social work. I ended up working for another 5 years after I graduated with my undergraduate degree. And I was working as a family service coordinator for the Arkansas Regional Organ Recovery Agency. My job was to approach families for organ, tissue, and bone donation. And I loved that job. By this time, I had been doing death and dying with hospice, organ donation for about 6 years. And I loved it, but I was also burning out. And I knew I'd kind of reached the ceiling of what I was going to be able to do without my MSW. And I decided in 2006 to go back, and I did an in-person program at the University of Arkansas in Fayetteville. And just from day one, I knew it was the right choice. But all of that is kind of the culmination of what led me into the profession. Yeah.
I love that. And I love that you met social workers early on, and that even though it took, sociology undergraduate degree, continue working in the field under that sociology degree, which I think is important to note, doing death and dying, working in hospice, that rooted seed from a little girl never left you, and you were able to finish it up. Yeah.
Yeah, that's true. That's a good point. Even in high school, my parents would say, what's wrong with you? But in a joking way. My friend Michelle and I would take trips to go see the AIDS quilt. This was in 1991, and ended up working at the AIDS task force when we were 16, volunteering. It was 1991. My parents thought I was crazy. They were also terrified we would get AIDS because there was so much misinformation. But I do feel like the seed was planted in early childhood, and it just grew.
I love that so much. Ashley, so you got your MSW. Again, reading your bio, looks like you have such a diverse social work experience. How did you know? Because, sometimes I talk to social workers and they've been with one agency for 13 years, right? How did you know to diversify your experience in the way that you did? And you can go into even the types of work you did do.
I feel like I have had tremendous luck with the mentors I've encountered in my career. So I did the 2-year MSW program because my bachelor's was in sociology, and my first internship was under a woman named Val, and she had an organization, a nonprofit called Just Communities, and they did diversity trainings, and this was in Northwest Arkansas. So they did trainings for Walmart, Tyson, JB Hunt, local organizations, youth groups, high school groups. Loved it. Loved that work. My year-long internship was at a local community clinic. And the community clinic in Northwest Arkansas is kind of amazing. Walmart, Tyson, and JB Hunt, say what you will, they funnel money into the community. And the community clinic is one of the places that really benefits from that. Springdale, Arkansas has a large Hispanic community and Marshallese community. There are more Marshallese people in Springdale, Arkansas than there are on the Marshall Islands at this point. And so I had the opportunity to learn grant writing during that internship. I learned about the Marshallese community, working with the diabetic educator, or not working with, I was mostly observing because she was a nurse. But it taught me nonprofit administration, management, grant writing, that kind of thing. And so as my internship was about 3/4 of the way through, my supervisor said, would you be interested in coming to work here after you graduate? Of course, yes, please hire me now. And so we wrote a grant that funded a project manager position for the Northwest Arkansas Tobacco Free Coalition. And I became the project manager of that. And that led me to work on legislative initiatives that helped end smoking in restaurants in Arkansas. We got some stuff passed regarding the age of children in cars, how old a child can be if you're smoking in a car. We started lots of information about third-hand smoke, not just second-hand smoke, and the dangers of that. If you have a child's blanket on the car seat and there's smoke, second-hand smoke on that, it becomes third-hand smoke, and those are still live carcinogens. Lots of public education, all of that. But I knew I wanted to get my LCSW. My professors in grad school were very much in favor of whether you do macro, micro, whatever, get licensed and do it quickly. Go ahead and just do that. And so my licensing supervisor, my clinical supervisor, Chris, was an angel straight from heaven, a wonderful woman. She and the psychiatrist she had worked for years, for decades, were in charge of opening a new adult inpatient unit in Springdale. And she said, why don't you come get some clinical experience? We're doing supervision together. I'll be with you on the unit every day. I had zero clinical experience, even from my internships. So I was very green. And Chris took me to see the unit. I'll never forget the first day. I step off the elevator onto this locked unit, and I see a man holding hands and skipping down the hallway with a woman in scrubs. And I looked at Chris like, what is happening here? What's going on? And she said, oh, that's Dr. H. He is earning trust. This person was actively psychotic, and they were just building trust. And I thought, oh, wow, he's amazing. And he really does have a social work spirit. And so I ended up on this unit. We started with 11 patients. 11. That is so lucky. That's such a small number. Full nursing staff, fabulous mental health techs, Dr. H at the helm with his social work spirit, and Chris by my side the whole time. And I worked there for 2 years and absolutely loved it. Fell in love with inpatient, fell in love with, seeing people come in who are very, very sick and seeing them get better, finding resources to help them stay better, connecting them with community resources, housing, all of it. I ended up supervising interns, and I loved that. And so I always kind of knew I wanted to end up in academia, but that just cemented that for me. And so that's how I went from macro to clinical. I left the unit when my husband got a job in another town. We had to relocate. And I just had a baby, so I stayed home for a year with her. And that is when I went back to work, that's when I got into community mental health, which included school-based therapy, intensive family services, which was super intense. No pun intended. That was a lot. That's where a caseworker and I would have a caseload of 6 families. We were there to kind of a last-ditch effort to prevent removal of children from the home. And that was a tough learning experience. But I love community mental health because I feel like so many people don't get access to good, strong, sound mental health care because they can't afford it. And where I practiced, I had a fabulous supervisor. She was actually an LPC, but she just really knew how to bring everyone together. She had such a positive attitude and really genuinely cared about the people we served, and that trickled down. So it was my community mental health experience there was great.
I was literally just talking to someone this morning about community mental health. Their dependent didn't have a good experience with it. And I said that there are a lot of folks, I was talking about social workers. There's a lot of social workers who are passionate about being in community mental health. And so sometimes it's maybe not the people that are in the community mental health working, it could be our resistance to being on the healing journey and just to keep showing up, because folks who are doing that work, I thank you guys who do that work. It's almost like folks who do DFACS and DHR work. It's hard and it's tough. And though, so if you're a client, just keep showing up. Just
Yes,
keep showing up, because being on that healing journey is probably some resistance there. And so when we're resistant, we don't want to hear what someone might be saying. Yeah.
very true.
Yeah,
Yeah.
so just keep showing up.
Mhm.
I want to get into your licensing journey. I'm curious if you did it in Arkansas. By the way, I am licensed in Arkansas, and I was born in
Nice.
Arkansas, so I love that connection. Yeah. But where you did it, and what that journey was like for you in a state other than the state that I'm in. But before we get into that, I wrote down musical theater. I love that so much. My sister is a music therapist in New York, and we are often trying to figure out ways to combine social work and music. And so I'm curious, even with your diverse bio, I didn't see that. And
Mhm.
I'm wondering, like, have you found ways to bring the theater, to bring music into your work with your clients?
I have. So at one point when I was in community mental health, I did weekend groups at a residential boys' home for adolescent boys. And I could not find a way to connect with them. They were running all over me. I was just an obvious easy mark. It was bad. It was bad. Until one day I made a playlist and I said, we're going to just listen to music and I want you to draw whatever you're feeling, whatever song inspires you. I was kind of over it. I was like, just listen to music and draw a picture about your feelings. Okay, try to do something here. Please work with me. And they loved it. And so I started doing things like I would say, okay, next group, you all are going to pick your favorite song lyrics, phrase, chorus, whatever, and say why that speaks to you, or how that helps you identify as yourself, or how that addresses your trauma or your pain. And they loved it. When I did school-based therapy, we had a cool summer program. This was in a super rural area of Arkansas, very medically underserved. And so in the summer, kids would often go without breakfast and lunch if they didn't come to the school summer program. And so we ran the summer program from 7 to 3 every day of the week during the summer. Parents could come and eat breakfast and lunch with their kids also, which was good. And we would have music days, and it was a privilege for kids to earn. You can pick a song, you can pick 3 songs, you can to let them play the DJ, and we could really talk to them about, why did you choose this song? Tell us what this song means to you. Some kids would play the same song every time they got a chance, and just giving them the ability to express themselves. And we would talk about not feeding the sadness monster. Sometimes it can feel good to listen to a sad song. And also sometimes it can really keep you in that sorrowful or grief or pain space. And what's a song that, if you need to listen to that sad space song, what's a song that you can balance that out with? And so music is certainly something that I have used, and especially with adolescents and kids. Yeah.
Music is the soundtrack of our lives, right?
Oh,
I know that was in a book or a movie I heard, but I would like to think I thought it myself. But music is the soundtrack of our lives. And if we're not talking to
mhm.
our clients about the music they're listening to, what are we doing? What
I
are
love
we
it.
doing?
Yes.
Yeah. I love that background. And maybe one day you'll still get to Broadway. Maybe you'll
You never know.
You never know. You absolutely never know. Actually, I'm curious about, I love listening to people's licensing journey. And I'm curious about you, obviously you knew you were going to go into education and you could talk to us about that if you want to eventually, but how did you know you wanted to go ahead and pursue the clinical and what was that journey like for you?
Well, like I said, my professors in my MSA program really were very much promoting get your license, get your license. And so when I got the grant to fund my position at the community clinic, I knew my supervisor there was not licensed. She's straight up macro social work. And I met Chris. I'd met Chris previously. She came and spoke to our class about psychopathology. And I knew two of my cohorts were going to be working with her for supervision. And so I reached out to her and I said, look, I'm in a macro position, but this is something I really would like to do. Can we do a group? My cohorts were in agreement. Could you do a group supervision? And she agreed. And Chris and I just clicked. We just hit it off. She has, I mean, her experience is unreal, mostly inpatient. So her clinical expertise is like off the charts, crazy. And I just could not soak it up fast enough. Our supervision was so engaging. And when she approached me about working on the unit, I knew that was the perfect time to get the experience to back up the knowledge I had gained from her. And I always imagined myself as a macro social worker until I went to work on that inpatient unit. And then I just found my passion. I love people. And I decided I can still do macro social work as a clinical social worker. I cannot practice clinical social work as a total macro social worker. And so I just committed to it and really focused on that. And then, so I got licensed in Arkansas with my LCSW. And then when I moved to Alabama, where I live now, I got reciprocity. And then eventually now I have my PIP, so I can do supervision, work in private practice, all of that. So really it was the encouragement from my professors, and then just having the best clinical supervisor ever that just really encouraged and nurtured that part of me.
So good. So good. And I like that you said that you realized you can do macro practice as a direct practice clinician. I think that folks don't realize that. I know I'm kind of putting you on the spot a little bit, but can you think of an example of how you continue to do the macro practice as well? I know, well, when you were solely doing micro or direct practice, can you think of an example when you could combine the two?
Absolutely. So when we were doing the school-based summer program, the school was throwing away a ton of food, and just at the end of every breakfast and lunch. And these kids were really going home hungry. I mean, they were not going to eat until the next day, many of them. And on Friday, you knew that they were going to come back on Monday just starving. Maybe they would have some dry ramen, maybe some PB&J, maybe. There are some kids that did not. And we worked with the school to change the policy about food and what was allowed to go home. Now, the FDA has regulations about food that cannot be undone on the local level. But that is something that we were able to do, work with the school so that kids could start taking that food home, some of it at least, and not just have it all go in the garbage. We also worked with the school to start a policy because we wanted to have a pantry, and a clothes closet. And everything has to have policy. Everything has to have a regulation. And so we worked to develop that. Another situation I can think of is with, in terms of public health and safety, it would be the smoking initiatives, especially with children in the car, but then using that to educate my clinical clients about that issue and helping them understand, and then teaching my clients how to engage in policy. How do you reach out to your legislator? How do you contact your representative without feeling afraid or overwhelmed? And how do you present your case to them? I worked with lots of clients on writing letters to legislators, especially clients with disabilities, yearning for greater access to care, to resources, to parking places that are appropriately designated. How do you write a letter, and what does that look like? And so sometimes that would be an entire session. Let's put a letter together. Let's practice, let's role play calling your representative. And to me, we're called in this profession to do policy practice. And so I feel like it needs to be part of it.
Absolutely, we are. That's part of what we're supposed to be doing, policy
Yeah.
practice. Yes.
Yeah.
I love your students are so lucky to have you, to have both that macro and micro experience. And so how did you move into the DSW, and what has your teaching experience been like thus far?
Well, like I said, I always knew, I thought I wanted to end up in academia. And in 2018, I found my birth family after doing a DNA test. So I was having some medical issues, nothing serious, but my doctor said, gosh, I really wish we knew certain things, and my insurance would not cover genetic testing, of course. So he said, just do the 23andMe, just do it. Just see what happens. So my husband gave that to me for my birthday. And I had no idea that 8 days after I got the test, I'd be on the phone with my birth mother. And it blew my mind. It rocked my world. It completely, you talk about a paradigm shift. Everything became just crazy to me. And it really became overwhelming. And so I was talking to my very best friend, and I said, I have all these questions. I started keeping a list of questions in my phone, my notes app. I started going to therapy, and my therapist said, you need to write everything down. And I called my college roommate and best friend, and I said, I think I have enough questions, and now I need answers, and it's time for me to go back to school. I want to figure this out. I need to learn and understand adoption trauma. I need to understand how this is affecting people. How can we make adoption less traumatic for people? How do we make it better? And that is really the catalyst that pushed me to go ahead and apply for the DSW program. I knew at this age, with 2 adolescent children, a PhD program was not the fit for me. I love research, but I am a clinical social worker. And so the DSW was perfect in terms of having that balance of practical application and research. So that really is what led me there. As far as teaching, I love it. I mean, I absolutely love it. I always loved mentoring interns. And so it feels a little like that. The department is small, very cohesive. I feel fortunate to be working with my peers. They are so supportive. I feel like I can go ask, there are multiple people I could ask anything and really get some sound feedback, no judgment. It's very much a social work focused environment. And, in some larger universities, it doesn't feel that way. And so there's just a lot of camaraderie, support, and the students are fabulous. They're so engaged. I learn from them all the time. They're always challenging me. And so, yeah, I definitely feel like I'm in the right place.
Ashley, what a beautiful story. What a beautiful story. And thank you so much for sharing part of your adoption story. I want to know all the things. but I can't. I have to move on to the next question because I'm like, oh my gosh, wow, that is such an amazing story. It really is. Talk about resiliency. Talk
Yeah.
about what resilience looks like. I think dictionary resilient, Ashley,
Thank
Toland,
you.
sorry. Yes,
Thank you. I appreciate that.
yes.
Thank
I
you.
love that. Ashley, you kind of hinted a little bit on it, but one of the reasons I decided to do this podcast was because I wanted to create community. I love social work community. I missed it when going into solo practice, and then also the pandemic. And so being intentional about creating community was important to me. What social work communities do you belong to or have created, and what have you learned about yourself being in those communities?
Well, I would say my very first social work community was my MSW cohort. We still have our original Facebook page and we still communicate with one another. If there's a death or a birth, we're all still putting our money together. If I need a referral or need to send someone to someone in Arkansas, or if they know someone in Alabama, we are constantly reaching out to each other. And so that really showed me the power of community in social work. I'm a member of NASW, of course, and so I stay connected through that. But I would say, when I went into private practice in 2017, I agree that the community went away in a sense, unless I was at a conference or things like that. And so staying connected with local social workers, going for coffees, reaching out and saying, I've got this issue. Can we meet and just have an ethics discussion about this? Or someone reaching out to me, all of that mattered. And then political activism definitely is a way that I've stayed engaged with other social workers in my community. There is a pregnancy shelter near here where I have volunteered hours and was able to connect with other social workers there as well. And that was a good thing. I think for me, in terms of community right now, of course, it would be the social work department at UWF. And that feels very much like a solid home community. But I agree with you that social work is not a solitary sport. It's not meant to be practiced alone. We're not meant to be solitary creatures. And it is crucial, I think, for ethical practice and for sound practice to always have some group of people, doesn't have to be too many, that you can bounce ideas off of, because you can get in an echo chamber real quick, and that's not good for you or your clients. And so, yeah, community is important.
Absolutely.
Mm-hmm.
You can't be your only voice. I love that. Thank you for
Mm-hmm.
that. Ashley, what is one belief about social work that you started on the journey with that you feel has changed the most?
Well, when I met Ruth and when I got my very first job out of college, I really thought social workers gave out food stamps and took babies. That's the extent that I knew. That was my point of reference. And I never probably would have chosen social work if I hadn't met someone like Ruth. This idea that social workers are hard, that they are, just going to take your babies, that there's no, almost like a coldness in the way social workers are described when you think about Department of Human Services or Department of Human Resources, depending on where you live. That I had this idea. I also had the idea that social workers could not make any money. You were going to be poor if you're a social worker. And I mean, you can be, but there's money to be made. So I had these ideas that social work was it was a hippie profession for people who didn't care about money, and they were just going to take babies and give out food stamps. And that could not have been further from the truth. I know that that's not true now.
Yeah, that's definitely not true. Yes, I
Mm-hmm.
keep hearing that same thing that is so the one of the major beliefs that I keep hearing repeatedly is that social workers don't make any money, but
Mm-hmm.
there are social workers who are struggling financially, but when you're able to be brave and take risk and put yourself out there, there's definitely money in this profession.
I agree.
Yeah. Actually, I've so enjoyed our conversation today, and I actually am in my last question. And it's been such a soft conversation. We're about to talk about maybe something some would see as a little tougher topic, but I wanted to go ahead and go there with you because it is in your bio, and I don't get to speak openly about this, and I feel like I could with you. So I'm always curious when I speak to or meet white women within our profession who intentionally and purposely move into the social justice arenas and speak on white supremacy and white privilege. What words of advice would you give to others wanting to do more work in those areas, but maybe afraid of being judged or offending others?
I think that this is an important question and one we need to discuss more openly, especially in a field like social work. For me, I feel a real obligation to learn from our past and make the future better. And I feel strongly that words without action are meaningless. I don't think there's a purpose to that. It feels hollow. And as a white woman who has worked with diverse cultures, who has a diverse friend group, and who has had my own experiences with, especially in childhood, I'm thinking seeing children of color in the hospital who were treated very differently. And I noticed that at a young age. I really feel that it is imperative for white social workers to learn, do their work. You and I talked before we got started recording. Don't rely on your Black counterparts to educate you. One of the best books I recommend is The Rat Was Also White. That's a book that white people need to read. I think that it is important for people who want to be allies to know when to be quiet and when to listen. And sometimes being an ally is just being present. But I would say the biggest, most recent catalyst would be the Women's March in 2016 after Trump won his first election. I went to one of those marches and I was like, where are the women of color? There are a bunch of white women here, mostly white women, with the pink hats that everyone crocheted. I did not have a pink hat because I don't crochet, but, and then the talk started happening about intersectionality. And that was around the same time of the birth of Black Lives Matter. And I felt embarrassed that I had fallen into the trap of not being intersectional at such a pivotal moment in our history and allowing division to be sown when we need each other and we need to understand each other. So at Tulane, I was very fortunate. Well, backing up to community mental health, my clinical supervisor in community mental health is a Black woman. And so I had a very positive experience of learning from and working under a Black woman. My mentor at Tulane is a Black woman. And George Floyd was happening during my time at Tulane. And it's something that I can remember feeling like I want to ask my mentor, I want to see if they're okay. But I also knew she doesn't need to comfort me because I'm worried about her right now. And it made me start thinking about things in a new light. And she invited me to write that book chapter, the Denial to Disproportionality. And then I would say in writing that with her name is Joan Blakey, by the way, and she is magical to me. I have so much respect for her. In writing that chapter, one of the book editors, his name is Alan Detliff, and he is at the University of Houston School of Social Work. He has a movement called the Upend Movement, and you can find that online. And it is all about abolishing the family policing system, which I feel very strongly about. Our family policing system is corrupt. It is racist. It is. I don't care what anyone says. I know it. I have worked in that system. I have seen it. It is wrong. The school to prison pipeline is wrong. For-profit prisons are wrong. And it's all structural and it is all rooted in racism. And I know this. And so it is my duty to learn and to speak up when I can, to be quiet when I need to, and to just be present. And so I say, do your research, read, talk to people. It's okay to ask questions and to acknowledge that I'm asking this with privilege, and I understand that you may not want to answer this question, and I respect that. Learning to accept no, figuring things out on your own, but take the blinders off, look at what's happening in our world, and do something about it. I feel that we're at a breaking point, and it is not something that can be ignored. And while this is not something that I should ever be the face of, I should never be at the forefront of any movement involving people of color. I want to be a supporter. I want to be an ally, and I want to contribute in any way that I can. And so the best way I know how is learning, doing my research, and writing about it.
And then talking about it.
Yeah,
And then
and
talking
talking.
about it. Not just being in the shadows, but literally putting it in your bio and then
Yeah.
being okay with talking about it. So
You have to be, I talked about white privilege in one of my classes last week. And, I could see some people stiffen when I even said the phrase white privilege. And, I said, this doesn't mean that you haven't suffered in your life as a white person. It just means, and this is a quote from someone else, I can't take credit for this quote, and I can't remember who said it. I said, it just means that your skin color isn't one of the things that has made your life hard. And that's real. And if you still have a problem with that phrase, you probably need to ask yourself why, and let's talk about it. It's okay to talk about things. We've gotten so big into cancel culture and, just being so afraid of offending people. And I think when people have good intentions, we can tell, and it's okay to have these conversations.
and I'm gonna be transparent here. It because of my own experiences, it's often hard for me to talk about have these conversations with white people. And so I'm even struggling with how to have this dialogue, even though this is my space and it's safe. But that speaks to the history of our nation, right? And I want to even say it speaks to our profession, because as someone who did work in academics and wanting to talk about these topics with my students, I got called to the administrative office for being racist for showing the documentary 13th.
Wow.
And so it is important that people who don't look like me are having these conversations with people who look like them, because we're getting called. I got called to the mat even just for showing a documentary that talks about the history of some of the things that people of color have gone through. So I
I'm
thank
so
you for
sorry that
doing.
happened. That's not okay.
It wasn't, and but it's what makes me nervous about having these conversations. And so thank you for putting it on your bio and being willing and open, even as brief as it was, to have this conversation with me today. And thank you for coming on the Goddesses of Social Work podcast.
Thank you, Renita. You made this very comfortable, and I appreciate what you're doing so much. Anything to highlight social work, and I'm so glad to meet you. It's really good to meet you. Yeah.
Thank you for listening to today's episode of the Goddesses of Social Work podcast. We are glad you were here. If you liked this episode, please come back to hear more stories of the journeys through social work, and please leave us a review on Apple or Spotify. See you next time here on the Goddesses of Social Work podcast.